Good morning, everyone, and welcome to CDA's Ensuring Equity in Aging webinar series. We're really excited today to focus on culturally informed services with and for older immigrants and refugees. Before we get started, I'll go through a few logistics. We are offering live captioning streamed through webinar today. At your toolbar on the bottom, if you hit the CC closed captioning button, you should be able to activate that. And we also offer American Sign Language interpretation. You should be able to see the interpreter right now. Now, we will post the recording, the slides, and the transcripts of this webinar on our California for All Ages Equity in Aging Resource Center. And we'll also have the recording on our YouTube channel. All of our past recordings are also at that website. The final 10 minutes of this webinar is reserved for questions and comments. So you can use that Q&A function at the bottom of your screen to enter in a question. Some speakers might answer during the presentation, or we can answer those in the final 10 minutes. And if you're on the phone, you can press *9 on your dial pad to raise your hand and be added to the queue. If you have any extra questions or need any more information, you can always email us at engage@aging.ca.gov. Next slide. We have had these webinars every month since November, and our final webinar will be July next month, 2021. That doesn't mean we'll stop offering content like this, but this series in particular, we're going to wrap up next month. Our topic is TBD. And I hope that you will just continue to join us for these activities, go back in time and watch the older transcript, watch the older videos from our webinars on our webpage. They're great free training tools for your staff as well. So please share those with your colleagues in your network. I'm going to go ahead and hand it over to California Department of Aging, Kim McCoy-Wade, Director Kim McCoy-Wade. She will do introductions of today's speakers.
Good morning and welcome to everybody. And we are so pleased to be continuing this series, but to be focusing today on immigrants and refugees who make our country so strong. I am delighted that at the Department of Aging, we oversee a suite of programs from the Older Americans Act that have never conditioned services on status or income, that our services are available to all older adults. And we really are at a historic moment where that spirit of California for all and services and access for all are, I really believe, at a historic turning point. I'm so delighted that we're coming the day after President Biden and Vice President Harris here from California, first daughter of immigrants to be, a child of immigrants to be in the White House, proclaimed this month National Immigrant Heritage Month. And I commend to you the proclamation. I'll just read a brief piece of it because it is so moving. The president's proclamation says, "America is, always has been, and always will be a nation of immigrants. It was the promise of our founding. It is reflected in our Constitution. It is etched upon the Statue of Liberty. Across each generation throughout our history, wave after wave of immigrants have enriched our nation and made us better, stronger, more innovative, and more prosperous." That's certainly true for my ancestors who came here from Europe over many generations, and it's certainly true for the people of California and the wonderful panelists we have here today. Before I introduce them, I also want to just lift up the other element of the historic leadership that we see, which of course is our own state of California. Our governor, in his bold comeback plan, made a historic proposal to extend healthcare for all to older adults, regardless of immigration status, to the age of 60, and also to increase that basic income payments to older adults and people with disabilities, including immigrants, through our state's companion program, CAPI. We love our acronyms in California, but the California Assistance Program for Immigrants. But the legislature's budget was released, their proposal was released yesterday, and builds on that to bring, they're proposing to bring the health insurance to older adults, regardless of status, down to 50. They're proposing an even larger increase in that basic income. And they're proposing a historic expansion of food assistance to people through the CalFresh program who are, again, in the California companion program, the California Food Assistance Program, that is broader eligibility for status. So we have a great vision from our national leadership. We have great proposals from our state leadership. And here we have 3 more of those amazing national, state, and local leaders to talk with us about how we put that vision and that policy and that funding into reality for the people we serve. So without further ado, let me introduce our all-star panel. We have my former colleague from CDSS, Brittany Johnson, who's from the Refugee Programs Bureau. She will speak about services to older refugees. She's been with the state of California for over 9 years and has terrific experience from the the CalWorks program, as well as the tribal TANF program. So that's great. Thank you, Brittany. Then we'll hear from Felia Ajitari. Felia is the program manager at the Union of Pan-Asian Communities in San Diego. She's been working with older adults since 2003, and her journey began with chronic mentally ill older adults in various roles at her local agencies. She's done peer counseling, and the current program she manages is Elder Multicultural Access Service and Support Program, and she oversees a team of 9 community health workers representing Filipino, Somali, Latino, African American, Chaldean Middle Eastern communities in San Diego County. And last but certainly not least, Wajia Khan is the Senior Director of Adult Behavioral Health Programs at La Familia. Wajia is a licensed mental health professional and Senior Director for Adult Outpatient Programs at La Familia Counseling Services, and oversees 6 community mental health programs, 2 which focus on serving Spanish-speaking communities. She also has great experience intergenerationally with families and as well as chronically homeless adults with severe mental illness. So as I said, we have a all-star panel. The moment is right. So I look forward to the presentation and the discussion from the public who's here with us today. Looks like we've got over 100 people once again. So I will hand it to Brittany to start the dialogue. Thank you.
Thank you, Kim, and good morning, everyone. Thank you for having me. So like Kim said, I'm Brittany Johnson. I'm with the California Department of Social Services. I work in the Refugee Programs Bureau, and I am in the Adult Refugee Services Unit. So a little bit about the Refugee Programs Bureau. Our mission is to provide state-level leadership and coordination of programs and services to achieve successful resettlement and integration of vulnerable populations in California. So the funding that we get from our ORR partners, we distribute that to our counties, and we just work closely with them just to make sure we are resettling individuals into California properly. Next slide, please. Thank you. So a few of the populations that we serve refugee youth, adults, and families. And all of these populations include asylees, certified human trafficking victims, Cuban Haitian entrants, refugees, individuals with special immigrant visas from Afghan or Iraq, unaccompanied minors, to name a couple others. We also serve repatriation individuals or families, and we have our TCVAP population as well. So first question is, who is a refugee? And a refugee is any person that is fleeing their country, their nationality, their country of nationality or habitual residence due to the fact that they can't return or they are in fear of returning due to fear of persecution based on race, religion, nationality, membership in a particular social group, or their political opinion. So when it comes to refugees, a refugee has been granted entry into the United States overseas in their country. And then the Office of Refugee Resettlement, along with your local county agencies and resettlement agencies, assist with bringing either that individual or family over into the United States. Refugees are eligible to receive ORR benefits and services from the first day they arrive in the United States. So one of the programs that is under that umbrella is our Soar program, which is services to older refugees. And this program serves refugees that are 60 years of age or older who arrive in the United States. And with our program, it will be individuals that arrived in California. So the intent of the SOAR program is designed to assist older refugees in accessing local services that they just might not know about. When it comes to the older population, sometimes they just need a little bit more of assistance, and this is what this program is designed to do. So our SOAR funds are issued to counties that are deemed to be refugee impacted counties. And refugee impacted counties are counties that have had to serve a minimum of 400 refugees in the last 5 years. Um, so a total of, it says 8, but it's actually a total of 7 counties that actually receive our SOAR funding. And I'll get into those counties a little bit later. So as you see at the bottom of our slide, over the last 5 years, the funding has significantly increased. It took a dip in 2018, but as you can see, it's been moving up ever since. So our refugee impacted counties include Alameda, Los Angeles, Orange, Sacramento, San Diego, San Francisco, and Santa Clara. Now, the 8th county, I believe, is Stanislaus County. That's a refugee impacted county. However, they do not receive our SOAR funding. So these are just the counties that receive our SOAR funding. Areas of focus under the SOAR program should include outreach, making sure we're reaching out to these individuals, making sure they're getting local assistance. They know about these local assistants, how to come in, fill out paperwork, and just making sure that they're linked to their communities and they know what's going on in their communities. Service enhancement, we're providing them with the appropriate services not currently being provided in their community. So again, that also ties a little bit in with outreach. We're just making sure we're getting the word out to this population so they know what's going on in their communities and how we can best serve them. Independent living, we're integrating these individuals into society. So we're just trying to make sure making sure we can help them become more independent, how to live on their own, and again just know what's going on in their communities, how they can be a part of their communities. And when it comes to the older population, that's probably one of the biggest things is they know their family, but as far as getting out into the community and knowing other people and knowing what's going on, that's a bit difficult. So, and then naturalization, that's one of the biggest things is helping them, with their paperwork as far as getting naturalized, interpretation, making sure they have the proper interpretation so they know what they're filling out, services like that. So supplemental security income and other federal benefits, just making sure that this population knows everything that is available to them and how we can, just best assist them. So some of the challenges currently going on, that like ongoing challenges with this population, like I said earlier, is accessing translation and interpretation services. A lot of these older refugees who are newly coming into the United States, they only speak their language, not only their language, but English is probably not their first language, and that's probably what they're struggling with. So just making sure that again they're understanding the paperwork, they're able to read, what's going on is really important. Finding transportation. Some of them, don't know the transportation system. Some of them don't have driver's license or just are unable to drive or get around by themselves at all. So making sure, again, we're able to take them to doctor's appointments and things like that. We have, a huge gap in services for this older population between 55 and 60 who do not qualify for SSI and SSP until age of 65. So again, it's just finding those local resources that do help them. And then limited work experiences. Some of the work experiences that they had in their previous country where they were living don't transfer over to the United States. So it's just, and then assisting them with, language barriers and employment, things like that. So currently, we've all been feeling, the wrath of COVID-19. So a lot of the COVID-19 challenges with this population, a huge one is the increase in isolation and mental health symptoms. I think we all can feel the isolation and the increase in mental health, symptoms, but I think for this older population, for them it's a little bit harder simply because, for some who, thrive on seeing their grandchildren or, things like that, it's all of a sudden they're seeing them through a window or just on FaceTime. They don't get that, physical connection, with them, with their family members. A lot of them, are, in the communities with like gardening programs and things like that. And that all of a sudden was taken away from them, just simple things as far as going to the grocery store that they no longer can do themselves. Just because there's such a vulnerable population in COVID-19. So, we've seen an increase in mental health symptoms with that. A decrease in completing Eosl civics classes due to the elderly refugees staying at home. So a lot of these classes are typically in person. And when this population can't, join these classes in person, it makes it a little bit difficult, especially if someone who's elderly is not as good when it comes to technology as, someone a little bit younger. So that's also a huge challenge right now. And a very, very big challenge that we are seeing is delays in green card approvals by USCIS. So right now, if you're renewing your green card, it's about a 7 to 8 month delay for renewal. And for applications, it's about over a year delay right now. So that in itself is, it's pretty hard for this population as well. So that's just my presentation of the Soar program. I know we have later on a Q&A for about 10 minutes. So if you have any questions, please feel free to reach out. But here is our information. You can find us at www.cdss.ca.gov/refugees. We also have a fact sheet on our website. I can drop the link in the chat if there is one as well, or I can send it to someone to drop it in the chat. And then here's just our main bureau line at the bottom. And then you can email me at rpb@dss.ca.gov. You can put it to my attention if you have any questions. And again, thank you everyone for having me. And I'm going to now pass it over to Felia. Thank you.
Good morning, everyone. My name is Felia Ajitari, and my agency is the Union of Pan-Asian Communities. And since 1974, we have been providing health and services to improve the overall well-being of underserved diverse populations. My program is, next slide. My program is the Elder Multicultural Access and Support Service Program, which is contracted by the Behavioral Service in the county and the Office of Refugee Coordination. And we are a prevention and early intervention program to provide underserved senior ages 60 and over with services in the Filipino, East African refugees, Latino, Hispanic, African American, and Chaldean Middle Eastern communities of the North, Central, South, and East regions of San Diego County. Our funding sources come from the Mental Health Service Act, which is about 90% of our funding, and the 7% from the Services for Older Refugees program. Our goals are to provide seniors with access to care, reduce disparities of care, maintain self-sufficiency, reduce ER visits and specialty care, increase knowledge of health and mental care systems, and prevent hospitalization and institutionalization. We have a two-pronged approach. We provide a center-based, a one-stop senior community center that provides resources and information and education and social and recreation and cultural activities. And we provide the promotora model using community health workers versed in mental health that go out into the community and provide peer education and support where the seniors reside. This is a pre-COVID model. Right now in COVID, we have been continuing to engage our seniors via telehealth and via phone call and virtual platforms to provide services to them. The promotora model that we use provides various roles for the community health workers. They become a bridge between the community and the mental health and the health systems. They provide culturally appropriate health and mental health education and information with topics relevant to seniors. They assist people in getting the services they need with care coordination, referrals, and follow-up. They provide informal counseling and emotional support and social support, and they provide advocacy services for individuals to help them meet their mental health care needs. The overall EMAS services that we provide are education in mental health literacy, education and training for mental health self-care, linking people to needed treatment and recovery services, addressing risk factors and protective factors such as fostering connectedness to help them reduce social isolation, facilitating support groups, promoting wellness, providing assistance with mental health and health system navigation, and linking individuals and families to other prevention and early intervention programs. The specific services for the refugees are for a mainstream outreach, providing informational referral in the community, provide access to ESL classes, legal services, translation and interpretation, independent living, providing counseling, social adjustment classes, networking and socialization, transportation services, and naturalization, providing almost a one-stop stop for citizenship and naturalization services and adjustment of alien status. Some of the demographics that we continue to have in San Diego, as you can see in the top graph, we can see the influx of refugees coming to San Diego County. We, in the years of fiscal year 2019 and 20, we saw an influx of Iraqi residents. And in the previous 2 years, which is the 17 on the top graph up here, we also had an influx of 8% of Iraqi. These demographics don't include the older adult refugees, but the next slide will provide the target population that we work with, which are the Chaldean Eastern community, Somali refugees, Middle Eastern refugees, seniors. And the next slide will provide some of the services that we have provided with some demographics of the seniors that we provide. We served in the past 6 months, 624 refugees. The main services that we provided was outreach with information and referral. The next one was translation. Number 3 on B is 219. For translation and interpretation, this is one of the main services that we provide, engaging and advocating for our refugees in other languages, And the last one will be the networking and socialization, because we have seen that refugees tend to isolate, and we provide engagement for networking and socialization. Some of the lessons that we have learned working with refugees is patience and consistency. It takes time to build rapport and build trust, and it's not an automatic thing. A Somali community health worker was sharing with me that she probably knocks or calls or makes contact with 130 places and people in order to find about 5 Somali seniors. And it's not an automatic rapport once she finds them. She still needs to take time to build a rapport with them and to build trust. I think that also being consistent with our delivery of services has helped. In one particular example, an Iraqi participant was not very happy to be in America. He was a lawyer and a CEO in Iraq, and he was having a hard time adjusting to America. And when we engaged him in services, he was not, he was displeased, and he was not having a good time about that. Through the education, information, and engagement that we provided, some of the education components always have an action plan. And during the year of services that he received, one of his action plan, after he began to adjust his emotional status about being in America, was to write a book. And the next slide, we can see the research that he did about his hometown, Telescope. And he wrote the book in a year. He received help providing with the help with his relatives and friends. He published 100 copies of his book, and he was very pleased with that accomplishment. And it was because Idmas was involved in his care during the time that he was here. The other lessons learned is that mental health continues to be a stigma for refugees. We help by assessing their mental health needs and offer linkage to services when necessary. We assess for symptoms every time we give a service, and we provide mental health education, and we make appropriate referrals. And we are happy that our county offers a yearly event called Check Your Mood Day in conjunction with the National Depression Screening Day. And one of these days, when we were doing the Check Your Mood Day, one of our Chaldean participants came and she was already connected with mental health services, but she was feeling unwell and wanted to check her mood. We provided her with the pre-assessment and she scored high, and then she decided that she wanted to do the long form, which is the PHQ-9. We discovered that she scored very, very high on the PHQ-9, and we immediately assist her in connecting again with her psychiatrist and counselor. They immediately saw her the next day, and when she came back to report on what had happened with her appointment, she was very proud in saying that she took her PHQ-9 questionnaire to the psychiatrist and counselor, and they were very curious as to where she had acquired that assessment. And she shared happily that IMAS helped her with identifying more of her symptoms, and she immediately received medication for her depression and more counseling sessions because of that intervention. Next slide. Some of the other lessons learned is that we are a part of a community network that helps us to help our refugees. We coordinate efforts with the four main resettling agencies: Alliance for African Assistance, Catholic Charities, International Committees, and Jewish Family Services San Diego. We also are part of the Newcomers Network, which is a monthly meeting where we learn about community efforts and collaborate with local projects and activities. As a result, we partner with Circular San Diego, which received an AARP challenge grant to create written transportation guides and maps for Arabic-speaking patrons in El Cajon. And our program collaborated with the translation of these materials. It is very difficult for Iraqi people to travel and to understand the intricacies of the local transportation, and these guidelines have been a godsend for these communities. The other community network that we have done is that through the CARES Act in October of 2020, we purchased 52 smart cell phones for our seniors in order to connect to our virtual classes and telehealth. And we have connected about 313 of our participants with information about the COVID-19 vaccines, as well as the coordination of their appointments. And lastly, we are collaborating with UCSD to launch a pilot program that seeks to create mental health interventions to decrease isolation among older adults. We continue to have challenges for the population. Housing is one of the main challenges that we are seeing. The rents are rising, and the families who came as a unit, their children are moving out, leaving older parents alone, resulting in rents that they cannot afford, and there is insufficient low-income housing in the community. Their transportation for non-medical service continues to be a challenge. Affordable tablets and computers and Wi-Fi for seniors, programs to teach technology to seniors in their target languages. Interpretation and translation continues to be a challenge, even though it has improved, it's still a barrier. There's not enough resources to serve the community. There's continuous stigma with the community and refugees, and they continue to feel unsafe. There's unreported mental health challenges and the multi-generational acculturation issues within the family that impact the older adults, and their mental health continues to rise. We are available for any question. We are operating remotely, but you can call us directly and you can find more information about our services also. Thank you so much. And I will now lead the other presenter. Thank you.
Thank you so much, Felia. I appreciate being here today. Welcome, everybody. My name is Wajia Khan. I'm a Senior Director of Adult Behavioral Health Programs, Adult Outpatient Programs. I'm a licensed marriage family therapist, and I have been working in community-based organizations for quite a while in the Alameda County. Very proud to be with La Familia Counseling Services, and I would like to first talk about the mission and as well as our vision and values. We provide underserved multicultural communities with the tools and support necessary to build resilience, wellness, and economic power. And our vision is to envision healthy, prosperous, and safe communities for all. Our values include belonging, partnership, self-determination, social justice, and integrity. And with that, I'd like to present to you the programs that I oversee. One of them is our in-home outreach team, which is a program, and all of these programs are adult programs, serving the adult programs with severe mental illness and support. And so in-home outreach team provides outreach and engagement services, linking adults to services needed. And this is a very crucial part of our adult programs, where, finding and locating individuals that are hesitating to find services or don't know where to find services. We have a wonderful team that is providing outreach and building rapport with lots of clients that are housed or unhoused, and just hesitant to really look into services. So our iHot team is one of the programs, and we also have our Access program. And this is a crisis stabilization program. We provide support and utilizing a brief therapy model. And this is for, adults that need support, not knowing where to go first. They could be experiencing trauma, domestic violence, or a significant event that has occurred in their life. They come to us seeking Spanish-speaking clinicians and support from people who are familiar with the culture and can really understand and relate to the relationship issues or the cultural dynamics that occur, and wanting to feel comfortable with that. So this program is a 6-month, crisis stabilization support service. And if care is needed beyond that point, we are then able to provide them with longer term care, and that is our service team. Service team is a team that involves a medical provider, a prescriber. We have 2 psychiatrists, and we have clinicians, we have case managers and a program supervisor, as well as a program manager. So the main focus of service team is to provide case management. This is case management to help community members feel empowered to utilize community resources. And many of our adults in the community are, not familiar with what resources are available at the time. And, so case managers are able to help them navigate through the system, and even go with them, transport them, basically be with them through the whole process so they're comfortable. And then at that time, until clients feel comfortable, we are constantly empowering our clients. The next one is the Reentry treatment team. And RTT is a program that assists clients that have history with the criminal justice system, and who have been incarcerated or have any history with the criminal justice system, and are needing support now coming back into the community. So whether clients need housing or employment services, they are needing some assistance in connecting, and assistance in just getting stabilized back into the community. So we have a team of peer counselors, and as well as individual therapists, clinicians that are helping to provide individual therapy, and as well as a program supervisor. So we are out there in the community a lot, linking lots of clients that are just trying to get back to functioning in the community, and to feel a part of the community. So that is the next. Let's see, the next. Yeah. Oh, okay. Yeah, I had some slides for each and every program here. That's okay. We can move on to RTT. Yep, there we go. And then Sally's Place is a respite home, peer respite home. This is a 2 to 3 year old program, fairly new, and we have a house on B Street in Hayward, and it's just mainly for community members that just need a place to go and be surrounded with compassionate peer counselors. So these are for community members that have an address and can stay with us for up to 14 days. And we follow a peer-based service model. And we are so proud. We are so proud to have this amazing peer respite home called Sally's Place. It's the first in Alameda County, and very successful. Right now we have, due to COVID, we had to, of course, make some adjustments. Before we used to have 2 people in a room, and due to COVID and the pandemic, we are now able to provide 5 beds. So we have rooms with just 1 person per room. And the services include activities such as, like we have art activities, we have support groups, we have yoga, we have painting classes. It's a place where someone can just de-escalate and connect with peer counselors who have been there, who have had to navigate through the mental health system, and can provide that support for our guests. Let's see, and then we have Working Wellness. Working Wellness, and we're very close to working with Brittany's programs. So CalWork recipients have the opportunity to connect to services such as therapy and job coaching. We have peer support for our clients from Working Wellness. And it is another program where we are providing lots of community support, helping people to find jobs, sustain a job, and be able to, look at those barriers, those mental health barriers that prevent them from keeping a job. And the whole basis around this program is to provide support around employment, because we feel in this program that having a job is an empowering thing to do. Having a job, finding a job, keeping a job, where you find your skills. And so we have an amazing job coach, and we have therapists, and we have a peer counselor who come together and really support adults in this matter, and it has been very successful. So those are the programs that I have. I just already talked about the Reentry employment program. Thank you. Yeah, those are my slides. I wanted to, just also mention the things that, history behind La Familia. I mean, we started in 1975, and Aaron Ortiz is our CEO. of La Familia, and he has an amazing story and journey. Just growing up in the community and very familiar with the needs of his community. And at an early age, he developed a realization that we need to provide programs, provide community services that will address the needs of our community. And he walked through those original red doors of La Familia on Mosine Avenue, which was, that's our headquarters, always will be. Lots of history in that building, and that's where all of my adult programs reside. And he continued his journey to receive his Master's of Public Health and did his internship at La Familia, in fact. We also have an internship program, and over 30 years now, it's been around for a long time. And so he has, there's really a lot of history with La Familia and has grown professionally with La Familia, and he is the CEO. And so his passion lies within the agency, and his leadership style is aligned with mine, service leadership, servant leadership, just seeing people successful in what they do, making sure that we are able to provide the tools and resources for our staff so that they can go out into the community and provide that for community members. And I feel the success around providing support for our immigrant adults, refugee adults, comes from the fact where we're acknowledging and respecting the culture while empowering our clients to learn about the resources. So just to give you a quick background, I am a firstborn generation, and my parents were born in India. And I'm 52, my mom is 79, and my dad is 82. And I can tell you today that speaking to them in my native language for 52 years, consistently and fluently, really helps me to connect with them and their needs, and just really connecting with them emotionally. And so knowing how beneficial it is to have this understanding through language and through the understanding of their culture, because I was born here, but knowing where their culture, what it meant to them, and trying to provide that emotional support as best as possible. I feel that makes my parents feel comfortable as aging adults. And at La Familia, I see the similarities where we're connecting with our clients, and we are providing community healing using culture and language to connect, acknowledging the uniqueness and beauty of the culture that our client adults are identifying with, but also empowering them to connect to community resources that will enhance their lives. So it being a liaison to maintain that culture and identity, and then the culture that their children or the grandchildren are adapting and assimilating to, is what we do a lot of, like building family relationships. And since we've been around for 46 years in Hayward, we know our community very, very well. And in fact, the other day, there was someone who stopped by and was walking by Mosine Avenue and said, I used to do my internship there. And this was an elderly gentleman. And that is actually so rewarding to hear. And so just wanted to share that. And I thank you so much for allowing time for me to share support services of La Familia.
Thank you so much. This has been such a fantastic presentation, and I'll I'll just share that when my family migrated to the United States in 1996, these community services that were available to them, whether it was English night classes or just support with employment, certainly navigating the naturalization and citizenship process, were really critical and really important, not only to them, but for other immigrants and refugees as well. So we do have a couple of questions that were submitted, and I want to pose them. So I think the first one might be for Brittany, but the question is about SOR funding and whether that funding is made available just to programs or to individuals. And if it does flow to individuals, can they also receive SSI at the same time?
Hello. So to answer that question, so the SOAR funding, yes, to answer your question, they can receive both because the SOAR funding is not necessarily funded directly to an individual. It's basically funded to programs that assist this certain population. So like with resettlement agencies and things like that, they receive that funding to assist, this population. So that should not affect, if the person is of age to receive Social Security, then that should not affect them.
Thanks, Brittany. I do see two more questions that were submitted through Q&A, but I do want folks to get engaged. So if you have a question or comment that you'd like to share, certainly drop that into the Q&A. If you're joining us by phone, you can press *9. That'll add you to the queue, and we can unmute your line to hear your question or comment. And certainly, if things come up after the webinar, you can email engage@aging.ca.gov. So I guess our next question that I'm seeing is probably for Wajida and Felia. The question is, how much family support do your clients have? So, you're talking about older adults and assuming they have families to support them. Can you kind of talk a little bit about what's the pattern that you see in your work?
Sure, I can go first, if that's okay, Felia. We really try to include family members if possible, if the client wishes to, because that's how we would learn more about what our client needs and what kind of support they have currently, as well as how we can build a stronger social support system for our clients. So this is usually done during our intake assessment and throughout our time with our clients, is to really identify those relationships, because we know that the stronger the support system is, the better chances of treatment and the better chances of gaining that confidence and empowerment to function in the community. So we do a lot of collateral work. We do a lot of connecting with any significant member of the client's treatment. It could, so it could be a neighbor, it could be a cousin, it could be anybody. And we try to get that information from the client, and we really hone in on those buzzwords. Like, if a client says, yeah, my sister and I spent a lot of time, it's like, okay, now we know that there's a sister that we can connect with. So yes, we do provide lots of support, and we include family if the client chooses to, and it's always with the permission of the client.
We do see a lot of family as a unit, and with seniors, we ask permission for them to include their family member. And when that happens, we provide the information to the relative or the family member that the senior chooses to be helped with, and we work in unison with them to create a plan and a plan of action for them, and we include them as much as possible to help the senior and get their services that they need.
Great, thank you so much. There is a question, and I think Felia, you have responded to this one, but posing it to Wajida La Familia as well. Are there any programs within your program that serve family caregivers, whether that's to help them gain employment or to help them to become independent contractors, or maybe other types of support?
We don't have programs with UPAC that provide caregivers with that information, but we at EMAS, we work with caregivers, and we have some agencies that hire, or we are aware that some of the trainings come from the in-home support services. So if anybody asks about employment, we give them a list of resources in the community, and we certainly guide them to the in-home support services that they have a specialized training for that. Mm-hmm.
I think we do the same too, Felia. We also, provide those resources. We're always a liaison to, community resources. Alameda County Crisis Support Services has a lot of support groups, and so we are always trying to look at some new support groups that are available for our clients and caregivers. I also wanted to mention within La Familia, we have a wonderful community outreach program called Cultura y Bienestar. And, it's a culturally responsive prevention and early intervention services. And it's funded by Mental Health Services Act funded program. And I'm mentioning this because it just includes all community members that need support and connect through culture. So we do have, programs that build resiliency and knowledge and practical skills, and lots of classes. So, caregivers that are interested in learning and connecting with others, they just have to call and get information for this program. It's a wonderful program, and in fact, right now they're doing a drum circle as we speak. So they're always doing like Zumba, drum circle, art classes, and it's a way to come together. So yeah, I wanted to just mention that as a resource.
Well, thank you so much. And I believe that individual who is asking about these supports for caregivers may be doing some direct outreach to you all to get some advice. So we'll move on to our next question. This one is about seniors facing eviction. The question is, I wanted to know where I can get help for seniors facing eviction. She's in so much stress dealing with this situation after the passing of her husband last month. So if there's any resources or community programs that you can speak up, that would be great.
Depending on, this is Felia, depending on where the person lives, they need to access an elder legal team. In San Diego, we have the elder law, and they can help with the eviction process by communicating with a lawyer. They'll be able to hear their case, and then they'll be able to assess. So depending on where they need, just look resources for law or elder law of some sort that can help with the eviction process.
Thank you very much. Okay, moving right along. I don't know, this one might be a question for Brittany, but certainly if either of you have a response, it's great too. Are there certain circumstances in which an individual who's not naturalized citizen receive Social Security benefits once they're 65 of age or older?
Oops. Can you ask that question again, please?
Oh, sure. Are there certain circumstances in which an individual who is not a naturalized citizen receive Social Security benefits once they are 65 of age or older?
So are they able to receive these benefits once they are 65 or older, but they're not naturalized?
Mm-hmm.
Okay. I actually do not know the answer to that question right now. I will have to get back to them on that one. I have to do a little bit of research.
Sounds good. So we'll swing back around.
Yes.
Yeah. Okay. Another question, understanding the needs of housing as huge challenges is mentioned. Do you think that RPB or the state could allocate funds for housing now or in the future? That one might be a swing back around to question as well, but I wanted to ask it anyway.
I don't have the exact answer for that, but I am hoping that the new California plan that we have, the master plan, will include housing as that and will allocate more senior housing and low income housing. And that is my hope for the master plan for California.
Thank you. Certainly the master plan for aging has the housing and as one of the top goals there. Wajida, did you have something you'd like to share on that topic too?
Just wanted to piggyback Felia, and also, it's just things are changing, and so we just keeping current with the different kinds of programs and grants and funding. I always my go-to is 211, and to really check in with what services are available for housing, and that's always helpful because they keep current with the grants and the services.
Thank you. There is a comment from Abdi, and Abdi is Felia's colleague over there at UPAC, who just wanted to highlight that UPAC provides all of these wonderful elder refugee services with a very small amount of funding. So big thanks to UPAC for that. And next question is from William. This is for Wajida. Does La Familia continue to receive funding from the state for those with disabilities and some elderly for employment opportunity or voluntary activity training?
We do, William. Thank you for asking that question. And what other services that I didn't include here, there's so many services that La Familia does, and feel free to check out our website at lafamiliacounseling.org. We do receive funding. We do have an actual separate department that supports individuals in the community with disabilities. So please feel that. Thank you.
Thank you so much. And it looks like our last question is about mental health. And I think Felia and Wajida, I think you both touched on the challenge of mental health services or mental health being a stigma. So how do you address mental health among the elderly population in smaller communities or in smaller cultures in which it's stigmatized?
EMAS provides this mental health awareness by providing a lot of information, and we also use the vocabulary that the refugee uses to identify how they feel. And when the vocabulary increases to understand the depression, anxiety, then the senior in a non-threatening way. Our education is about engaging the senior where how they describe their symptoms. Sometimes they say, I have a stomach ache, and we go with that information. But we are aware of the symptoms, and we are always training our community health workers on mental health. And by doing more information and getting the seniors informed about what it feels like to have depression or anxiety, then that helps us to address these cultural issues and a stigma in the community. And we do this very confidentially, and we take the pace of the participant.
Thank you, Felia. I just wanted to add also that that's the beauty of the services that we provide at La Familia, because we are focusing on communities that have that barrier to services, and stigmas and misconceptions, and a lot of education is definitely needed. But just providing, for example, a Spanish-speaking clinician and pairing them up to an adult or older adult who speaks Spanish, who is really wanting to connect with someone who understands what they're going through, is therapy in itself. Just acknowledging that a clinician can understand the family dynamics, the hesitancy of going out to, a doctor because of fear of not knowing what the treatment may be. And so our services include a lot of empowerment, as I had discussed in our mission and values. It's really about empowering our client to understand. And so we collaborate with medical providers as well, just to make sure that the information is being translated and conveyed accurately to the client. So our case managers support our clients in those steps as well.
Well, thank you all very much. I think we're about 1 minute over, so we'll transition and I will pass it off to Amanda for a quick closing. Thank you.
Hi, everyone. I just want to share CDA's sincere gratitude to all of our speakers today for sharing those myriad of considerations when serving older adults and refugees in California. I absolutely appreciate that person-centered holistic approaches that our speakers shared today for improving the well-being of older adults who do come from other countries and cultures. Also appreciate that you really emphasize that building trust and being consistent in providing support that is really reflective of those cultures and languages that your clients see, and then making the right connections, not just to programs, but really emphasizing that connection to other humans, like building human connection, which is so important for the health, well-being, and longevity of all of us, and older adults in particular. These slides and all the materials will be posted to our website. As always, check out the Equity and Aging Resource Center. We'll send a follow-up email with the links to everything within the next few business days. But other than that, I just want to thank everyone for being here. Please take care of yourselves and take care of each other. And we'll see you next month.